Hello everyone, welcome to Heal Your Heart EECP Treatment Center. Today we are going to discuss about one of the commonest misconception in the patient's mind when they are advised to go for any of the cardiac treatment. It could be a bypass surgery or an angioplasty or a EECP treatment. And many patients, when they come for my consultation, they come up with the idea that the bypass surgery or angioplasty would give them a longer benefit than EECP. In fact, one patient has told me that if he undergoes a bypass surgery, the cardiothoracic surgeon has given a guarantee of 15 years. Well, this is a highly surprising statement made by a cardiothoracic surgeon, if it is really he made this statement. Because it could not be true. If you look at this 15 years of guarantee, there is no studies in literature to show after a patient undergoing a bypass surgery, if they follow them up to 15 years, that most of them or 100% of them would be benefited, and the benefit will last even up to 15 years and the patient would be alive. The reason is many of the studies which is attempted to follow the patient up to 15 years and find out what would be the outcome has all clearly shown around 45 to 55% of the patient would eventually die after bypass surgery when they followed up to 15 years. So after 15 years, only around 50%, roughly approximately 50% of them would be alive. The largest trial called Barry 2D trial has followed this patient for almost 15 years. I found out around 48% of them are alive after bypass surgery. Well, there is nothing to worry about. The reason is bypass surgery is given only for patients with very high risk. So if you are a stable patient and would able to do exercise and you are only getting occasional angina with no heart attack, and then you should be very careful in choosing a bypass surgery. So now let us look at the other way. So what really can help the patient to live longer? Definitely it is not a surgical procedure, because even after bypass surgery, the procedural risk is around 2 to 4%. Even after procedure is done, the first 6 months is crucial, because during that time the graft occlusion can happen, and even after the 6 months you have to be very careful, because around the time of 5 to 10 years most of the graft will close. But in spite of the graft is closed, what made the patient to live longer is it's not actually the bypass surgery or stenting, it's actually the lifestyle modification. That is why we always tell the patient probably the lifestyle changes, for example quit smoking, improving your exercise, regularly walking, reduce your stress, and also have a good control over the cardiac risk factor like reducing your diabetes or controlling your sugar or controlling your cholesterol and reducing your blood pressure. These all will have a significant higher effect of prolonging your life when considering to bypass alone. So it's wrong to assume that bypass surgery will prolong life. This bypass and angioplasty treatment are all provided to improve your quality of life. If you are already stable, these procedures can able to improve your quality of life. To prolonging your life, it is mostly the lifestyle changes and cardiac risk factor modification plays a major role. So patient with blockage, they don't need bypass surgery and angioplasty always. There are alternative treatment called enhanced external counterpulsation, which can able to significantly increase your blood flow, and combining EECP with lifestyle modification will definitely have a higher survival rate when compared to a bypass or angioplasty.
ஒரு இருதய நோயாளிக்கு bypass surgery angioplasty சிகிச்சை முறை தான் முன்னாடி கொடுக்கப்பட்டுள்ளது. சோ இதற்கான மாற்று சிகிச்சை முறை EECP Enhanced External Counterpulsation Heal Your Heart Vaso-Meditech EECP Treatment Center.